Hi, I'm Dr. Frank Gabrin, and I believe that caring for others should be the most emotionally rewarding job on the planet. Unfortunately, for those of us who work in medicine, that doesn't seem to be the case. Current research shows that 64% of physicians across all specialties are suffering from at least one symptom of burnout. I believe the reason that we have a mismatch between what we know intuitively and what we experience clinically is the result of the fact that we do not take advantage of what we already know about our neuroanatomy, neurophysiology, neurobiology, and neurochemistry. The truth of the matter is that humans are hardwired to care by millions of years of evolution based on the survival of the species and survival of the cell. I'd like to illustrate how our brain actually is wired and how it works by using an example of human interaction that we've all had at one point in our life. If you've ever met a new baby, whether it's your own baby, your sister's baby, your cousin's baby, your friend's baby, first time you meet the baby, almost universally, you stare into the baby's face and you're willing to do almost anything that will get the baby to smile back at you and coo or giggle. The experience seems almost spiritual. It's so emotionally rewarding. You feel amazing when that happens. The truth of the matter is that it's actually a physiologic process. There is within all of us something called the mirror neuron system, or the MNS. And it's responsible for the process of mimicry. Evolutionary speaking, the reason that this system exists within us and takes advantage of all five senses is that the minute a new person walks into our environment, we automatically mimic whatever we sense in them. For example, it tracks pupil dilation, facial expression, timbre of the voice, posture, the advantage of this for us for survival is that we immediately feel what the other person is feeling, and we can recognize them as friend or foe, or a threat to our survival or the survival of those around us. So this MNS is capable of recognizing 7 universal emotions across all cultures, and only one of those emotions is positive, and that's happiness. The rest of them are negative. This happens underneath our conscious awareness, and we have no control over it. It's universal, it happens for everyone, and it happens always. So why is this important to us clinically? We actually come into contact with lots of new people every shift that we work, especially in the ER. There's patients, there's family members, there's concerned distant relatives. We have lots of different people that we're working with, including doctors, nurses, techs, and clerical personnel that are constantly coming in and out of our already emotionally charged environment. So when we go to see a new patient and we connect with them, automatically we feel what they are feeling. And generally that what they're feeling is some sort of pain or distress. So when we feel their pain, this is the definition or the beginning of the process of empathy. And neuroscientists who have studied this process have named this initial experience as affective empathy. And it's completely out of our conscious control. It happens automatically.